Hello, my name is Jason Putz. I'm a physical therapist at Physical Therapy Solutions in Dyersville and Manchester, Iowa. Today we're going to discuss TMJ, or joint or dysfunction of the temporal mandibular joint. Basically, this causes some people a lot of pain if they're doing a lot of extra chewing, trying to bite down on hard candies. Those type of things cause irritation to the joint line of the jaw. So in physical therapy, there's some things that we can do to kind of help calm some of that down. A lot of it's education about what to eat and what to avoid at the time when you're irritated, and also how to kind of modify certain things like yawning and things like that that really kind of cause some of the irritation and pain. From an anatomy standpoint, if you look at somebody's jaw, it's very, very close as they're opening and closing to really right underneath the ear. And so if you put your finger there, you can really feel that jaw opening and closing as you kind of palpate that area. One thing to note, a lot of times people will have jaw pain, but when we evaluate them, we find that they actually have a neck issue, because if you look at that, where that jaw is at, and in alignment of their anatomy of their neck, they also can have some issues in their neck that kind of can radiate some of those symptoms out into the jaw. So some people that come in, we also find that they actually have a neck issue rather than a jaw issue. Most people are coming from their dentist, and so we've tried multiple mouthpieces or other devices to try to kind of help them from grinding and doing things at nighttime. Here in physical therapy, one of the biggest things we'll do is talk about posture and anatomy, because if I'm sitting out forward, my jaw opens up a little bit different than if I'm tucked back. If I'm looking to one side versus the other side and I chew, you can kind of feel that there's a difference between doing that. Basically, if you're really irritated and inflamed, we can use modalities with some anti-inflammatory properties to try to decrease some of that pain and some of that inflammation. And then we really talk about the posture and positioning, as well as eating habits to make sure that people aren't irritating that joint while they're talking and eating. If you want further information or have any questions, feel free to give us a call at Physical Therapy Solutions in Dyersville at 875-8615, or over at Manchester at 927-1499. You can always look us up on our educational tab on our website at ptsiowa.com, and we're constantly putting out new educational videos here on our Facebook page.